Okay, so what is Molluscum Contagiosum? What is it, doctors? It's a Molluscum Contagiosum virus, or we call it molluscum, common viral infection of childhood that cause self-limiting infection of the skin. Okay, this is a self-limiting skin infection. No need investigations. Okay, because they don't need any treatment. Most cases resolve spontaneously within 6 to 9 months. Okay, so please remember this can be spontaneously healed within 6 to 9 months, but lesions can persist for more than a year, and there's no exclusion criteria from daycare or school. So please remember, for impetigo, there's no school criteria, there's no treatment, and there's no investigation. But in some cases, we can also. Then here, molluscum is a common viral infection of childhood that causing benign self-limiting infection. And here, molluscum spread by direct skin-to-skin contacts, fomites, like from towels, or auto-inoculation by scratching or touching the lesions. So how these can spread direct skin by skin, then fomites, or due to the scratching, right? Then auto-inoculation can happen. Assessment, diagnosis of molluscum made by clinically. So how it appear? It has firm, pearly, dome-shaped papule with central umbilication. So what you remember when you read in this one? In your mind, what is the thing you can remember while reading this part? Yeah, it's a BCC, right? The pearly dome-shaped papule with central umbilication. Kind of like, right? Yeah, we can feel something about BCC as well, but okay, it's not. It has, and here these lesions are white color, right? And lesions are usually 1 to 3 millimeter in diameter, but can grow to 1 to 2 centimeter as well. Lesion can occur anywhere on the body. The most common area is trunk, axilla, antecubital, and popliteal fossa and groin. Auto-inoculation is responsible for most anogenital lesion in the children. Then here I'll show a good picture. Here you can see. Yeah. Okay, like that. Yeah. Then, what are the complications? Eczema may develop in the surrounding skin. Recognition of molluscum can be difficulty, as eczema can obliterate the primary lesion. However, the carefully taken history about the appearance of initial lesion is usually diagnostic. The molluscum on eyelid margin can cause conjunctivitis. Doctors, give me 1 minute. You all can hear me, right? Okay, so the management do not need treatment. Exclusion from daycare or school is not required. And in this case, the molluscum cases, we have to what we should do, we have to make sure about the hygiene of the child, right? We have to avoid the sharing towels and bathing together may reduce the spread to siblings. Usually this can like the molluscum can be spreading in mainly in the water activities areas like that. Okay, 1 minute. And here, one more thing you should know: if patient needs the treatment, some treatment like cosmetically, they need something, then individual lesion can be removed by cryotherapy or curettage with or without topical anesthesia. This is not usually appropriate for younger children. Scarring may be worsened with this treatment. If they like in exam, they ask what is the treatment. So don't go with cryotherapy because this is no need of treatment. Okay. Yeah. And cantharidin is a topical blistering agent that does not cause scarring, and we can refer these patients if want, but usually no need anything. Give me 1 minute. I have to check if there is any questions for this or not. Mm. These are usually spreading from the bathing area, water activities area, like the pools, then water parks, like that. Okay. Sorry. Okay, doctors, let's read this. A 24-year-old woman present to the GP clinic with 3 weeks history of painless lumps in her genital area. She has recently started a new sexual relationship. She has no significant medical history and takes no regular medications. On examination and has no fever, itch, or discharge. On examination, she appears well with vital signs within normal limits. And there are multiple 2 to 4 millimeter flesh colored dome shaped papules that are not hyperkeratotic and appear to collapse in the center. Yes, no surrounding erythema and on lancing one of the lesion and no fluid is expelled. So, what is most likely to diagnosis? What is it, doctors? Okay. So, why not genital herpes simplex? How it present? Why not genital herpes? Tell me. Mm-hmm. Yeah, it's a very painful source, right? In genital herpes. Okay, here you know why. A genital herpes simplex virus typically present with painful vesicles that rupture from the shallow ulcers within the few days. The patient is often experience prodromal symptoms such as tingling or burning. The absence of pain, vesicles or ulceration make this diagnosis unlikely. Okay. And one more thing, genital molluscum contagiosum can be sexually transmitted and require counseling about transmission because this molluscum is spreading by skin to skin contacts, right? So in that case, if there's a genital one, can be partner also can be infected. Then, okay. A 42-year-old man present with GP clinic with a 1 month history of non-pruritic, non-painful skin lesion over his face and many other parts of his body. He has not had this before. He denies fever or recent overseas travel. He works as a sex worker and has multiple sexual partners. His last sexual transmitted infection bloods are pending, and there's no significant medical history and take no regular medications. On examination, he appears well with vital signs within normal limits. Multiple small skin lesions are visualized on his face, trunk, arm, and genitalis. His palms and soles are spared. This is the lesion. Which one of the following is most likely? What is it, doctor? Yeah, we all know because we are doing this topic. Yeah. Yeah, here also not painful, right? Yeah, the same thing. Mm, let's check. I think other questions also like the same. Okay, this picture is from um, handbook doctors. As I remember, there is the same color picture in handbook. Okay, a 4-year-old boy present to the GP clinic with his mother. Uh, Mother complaining of rash that has been present for the past 2 weeks. The rash consistent of papules of thighs and axilla is painless and does not appear bother him. He also has some excoriated areas over his elbow and knee creases. He has no significant medical history and no regular medications. His mother has history of cold sores, and his older brother currently has cold symptoms. On examination, he appears well with vital signs within normal limits. The rash is shown in here. Which one of the most appropriate management? Admit hospital and perform full septic screen with IV antibiotics. Discharge home with course of oral valacyclovir. Discharge home with course of oral flucloxacillin. Commence topical steroid reassurance and review in 4 weeks. So what do you think? YE? Mm-hmm. It's a molluscum contagiosum, right? This common self-limiting viral. Yeah. Okay, so the telangiectasis is in the middle, dome shape, right? Yeah. Mhm. Okay, that's all. Okay, so